Has many in Austria wondering how the women and her children will recover and what it will take. Joining us now from Los Angeles to discuss this is child psychiatrist Dr. Anandi Narasimhan. Thank you very much indeed for joining us, Doctor. I mean, the children are now in care. The mother is quite ill, we're told. But where do psychiatrists begin to start with a case like this?
Well, with a case like this, there's multiple factors to consider. The environment to put children and their mother in, and how do you care for these people, and how do you integrate them back into a normal kind of life that they have not known for such a long period of time. And for the children, they've never known. But what we do know that this is possible, no matter how severe the trauma was, and no matter how long it lasted, there still is hope that people can recover to some sort of functional kind of life, and that involves different aspects of treatment, regular therapy, and there are specific types of therapy such as cognitive behavioral therapy, which helps kids address things like traumatic reminders and what to do with their feelings of feeling overwhelmed and re-experiencing the trauma over and over again in their head, and what they do with those emotions and how they can alter their behaviors. And that's a very effective form of therapy in dealing with victims of trauma, and we know that it can be very effective. There's several research studies that support effectiveness of therapy, and sometimes there are other aspects of treatment like possible medication management and a community-based approach where you reintegrate them back into a structured kind of lifestyle where the kids go back to school and slowly regain a sense of normalcy.
But given that this is the only family structure they've ever known, I want to ask you about their mother. Is it fair to assume that she, having had what one might consider a quote-unquote normal life until the age of 18 or so, might actually have more difficulty or less difficulty than her children adjusting?
You know, it's really hard to tell. It depends on each individual. When someone might have a history of prior trauma or things that have been happening before, and something like this could be added on top of that. So it's, you know, it depends on their level of functioning prior to the trauma to determine, you know, whether one person is at an advantage of having a better outcome. And I think it varies by individual case to case, but, you know, you might be able to say that a person who's had some normalcy prior to the trauma may have a quicker chance of recovery, whereas people who've never been exposed to any kind of normalcy, like the children involved, it may take more time. And this is certainly something that can't be reversed overnight. It takes years for this sort of treatment to be really effective.
And what can be said, if anything, from what we know about the father in terms of his makeup?
Well, you know, obviously, people who conduct acts of this nature or similar acts of victimization, especially over such a long period of time, have to be pretty impaired in their level of functioning and their judgment and thinking. And sometimes these individuals have narcissistic traits. Sometimes there's this deep-rooted sense of inadequacy or loss of control within themselves, and the only way to have that control is by controlling somebody else or victimizing someone else.
And when you've mentioned the term narcissistic traits there, what exactly do you mean by that? I mean, we've all heard it in terms of, you know, joking social interactions, but what does it mean in psychiatric evaluation?
In psychiatric evaluations, it means somebody has a sense of entitlement or the sense of belief that they have this power, or they're able to do things of this nature, or they're able to control others, and just the sense of feeling like that they're have this kind of superiority and they can use that to behave the way that they do. That's often, you see that in narcissistic traits, and oftentimes these are people who are inside very, very wounded and very sensitive to criticism, and a lot of times these people have had traumas themselves as a child or as growing up, and in some ways they're reenacting that trauma.
All right, we must leave it there. We're out of time, but thank you very much indeed for joining us from Los Angeles, Dr. Anandi Narasimhan. Well, there's